Mr Speaker, my question is to the Minister of Health. Is he comfortable with the numerous announcements of health cuts in the last 20 months?
The Honourable Tony Ryall.
Mr Speaker, contrary to the member's assertion, the health budget in the last 20 months has in fact increased by over $1.3 billion. There always have been and always will be changes to services reflecting changes' needs, but this government is moving resources from the back office to improve frontline services and engaging doctors and nurses in that leadership.
The Honourable Ruth Dyson.
Can he confirm the reported comments of Lindsay Smith, Clinical Business Manager at Dunedin's Ashburn Clinic, that the clinic will drop 9.7 full-time equivalent staff due to a shortfall in funding? And if so, is this work currently being done by those staff backroom or frontline?
The Honourable Tony Ryall.
Mr Speaker, no, I am not able to confirm that quote.
The Honourable Ruth Dyson.
Can he confirm the reported comments of resident Dr Julia Taylor, who says that weekend and night shifts at Christchurch Hospital are often understaffed, that it's stressful and unsafe for both doctors and patients, and that it's only a matter of time before a major incident will occur? And if so, what, if anything, will he do about it?
The Honourable Tony Ryall.
Mr Speaker, I've spoken to Alistair James, the Chairman of the Canterbury District Health Board, as a result of these claims. Mr James assures me that no patient was at any risk of any harm as a result of staffing arrangements last week. Mr Alistair James, who is known to the member opposite, advises me that the Canterbury DHB is well staffed, with senior doctors for the first time in quite some time, and that they are playing an active role in helping to manage staffing issues.
Dr Jackie Blue.
Tēnā koe e te manapakawa, te Minister of Health. What reports has he received recently on improved frontline services?
The Honourable Tony Ryall.
Mr Speaker, I've seen numerous reports of improved frontline services from around the nation. A record rise of nearly 13,000 extra patients receiving elective surgery over in the 2009 years, much shorter waiting times for cancer treatment, and for the first time in many years, we are closing the gap for 2-year-old immunisations.
The Honourable Clayton Cosgrove.
To the Minister, does he acknowledge the cut in after-hour GP services in Rangiora, affecting 22,000 people, was done without consultation with the community?
The Honourable Tony Ryall.
Mr Speaker, changes to after-hours services in Rangiora have been made by the general practitioners in Rangiora. But I can advise, following representations from the Honourable Kate Wilkinson, that I'm advised that discussions are underway between Pegasus Health, St John and the Acute Demand Programme about improving services in that area, and that we would hope that there would be some announcements following that shortly.
The Honourable Clayton Cosgrove.
To the Minister,
Order.
why has his cuts forced the Canterbury District Health Board to do more with fewer resources, which has resulted in the removal of services from 1 July of after-hours GP care for the people of Rangiora, a service which they have enjoyed for 22 years?
Honourable Tony Ryall.
Mr Speaker, what I can advise the member is the decision with respect to after-hour services in Rangiora was a decision of the local GPs, which actually started at the time, and the scaling back of after-hours actually started quite some time ago. But what I can tell that member is that the Canterbury District Health Board this year received a massive funding boost of $50 million at the Canterbury District Health Board, a 4.2% funding increase, which has allowed us to provide more cancer radiation treatment, more elective surgery and an improved emergency department.
The Honourable Clayton Cosgrove. Order. 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 Not sure I was in the water at lunchtime today, but I don't think members need to carry on with shouting in unison. I don't think it's that becoming in the House. The Honourable Clayton Cosgrove.
Mr Speaker, to the Minister, given that answer, does he agree with his colleague Kate Wilkinson, who said on Canterbury television on 9 July 2010, quote, "The service is definitely diminishing," unquote, and, quote, "The DHB is being forced to do more with less," quote?
Honourable Tony Ryall.
Well, Mr Speaker, what I can tell that member is that that Kate Wilkinson is absolutely right when she says this, that the District Health Board in Canterbury has got an extra $50 million, and as a result, the latest data shows that we've had improvement in the number of nursing full-time equivalent staff by 170 extra, and the number of medical FTE has increased by 30 during that time. That's good news for the people of Canterbury.
The Honourable Order. Is it a point of order? Point of order, the Honourable Clayton Cosgrove.
Mr Speaker,
The Honourable Clayton Cosgrove.
thank you, sir. I asked a very specific question as to whether the Minister agreed with the statements of his colleague that the service is diminishing and the DHB is being asked to do more with less in respect of resources. I gave the date. It was a singular question, sir. He failed to go anywhere near that.
Well, order. The asking ministers whether they agree with a particular statement someone has said, if I remember rightly, the minister's answer, he said he did agree with a further statement that he attributed to Kate Wilkinson, and you know, where members ask ministers that kind of thing, do they agree with statements? It's very difficult to be pedantic about exactly how ministers answer such a question, because you know, I'm not going to you know, put the heat on ministers to really give a particular answer to that kind of question.
The point of order.
The Honourable Clayton Cosgrove, I'll hear the member further.
In your summary, you said that the Minister said that he agreed with another statement of Kate Wilkinson, and you were prepared to accept that. All I'm asking, sir, if he's prepared to say he agrees with another statement of his colleague, I'm simply asking him, is he prepared to say whether he agrees or disagrees with the statement I put to him? So how can both sets of answers be correct, sir?
I just want to put it to the member that when members seek opinions and questions, whether ministers agree with something, unless it's absolutely at the heart of their portfolio in terms of something they've done or that they've said themselves, then you know, it's hard for me to be too pedantic about answers to such a question, because where I insist on ministers answering a question from an opposition member, I want to be satisfied there's a genuine public interest in this, and political point scoring about whether or not a minister agrees with it. The minister is not strictly responsible for what Kate Wilkinson says. That's another difficulty I have, that if the Prime Minister is responsible for what his ministers say, but the Health Minister is not at all responsible for what the Honourable Kate Wilkinson might say, and that's why it's difficult for me to be more to insist on any particular answer. Now I'm allowing time for this to explain why I'm ruling the way I have, and I don't intend to take a lot more time on it. The Honourable Trevor Mallard.
And I won't take much time, sir, but ask you to consider whether when a minister is speaking, whether a minister in fact can take their hat off and not be speaking as a minister. The minister was quoted. She was talking on an area for which Mr. Ryall was responsible, but the way that we were taught constitutional law, and again when we first became ministers, was that ministers are always ministers. That ministers are always ministers, and when they speak, wherever they speak on behalf of the government.
Well, I'll hear the Honourable Gerry Brownlee, because I've heard the...
Mr Speaker, speaking to the point of order, you'll recall, sir, the various disruptions that occurred under the Helen Clark-led government in the early part of 2002, where the House turned itself inside out on this issue of what hat someone was wearing. At the time, there was considerable disagreement between the Honourable Jim Anderson and the Honourable Lila Hare, and the opposition was attempting to find out which public positions each of those ministers was